Welcome back. Now, it's a new beginning for mom as well as baby through a Mercy Health program aimed at a variety of supportive efforts for new as well as experienced mothers. This afternoon, we have with us Dr. Alicia Huckaby, who's telling us about New Beginnings. Doctor, thank you so much for joining us.
Yeah, thank you for having me.
Tell me a little bit about New Beginnings. What is it? What does it do? And honestly, who qualifies for it?
Yeah, so it's a program that we have out of our family care center, which is the clinic off Franklin and Bancroft. And it is for any individuals who are pregnant and are also struggling with substance abuse. And you can be at any point in that journey and come to us. So you can be, sober and in recovery, or you can be, struggling with sobriety, and we will take you into the program. And once there, you get weekly prenatal care and visits, and we do all-encompassing prenatal care. And you also get access to our mother and child dependency social workers who will work with you through, all of the struggles throughout the pregnancy and postpartum state. And we also have weekly group therapy sessions and weekly lectures on all sorts of things that can be helpful. Things from breastfeeding to anesthesia comes and does consults on, anesthesia during labor, to things like housing. I know that was an issue earlier today. Yeah. So we kind of cover it all and try to prepare these individuals to be ready to face those additional stress of pregnancy and postpartum.
Sometimes, folks, especially when medicine gets involved, sometimes we get a little nervous and we get defensive, like, well, I don't really have a problem. It's just something that I need every day. Yeah, it's like breathing. Breathing's not a problem, doctor. But how do I get over that fear? Or maybe I know a mom who might need your services. What's a great way to talk yourself into at least just stopping by?
Yes, yeah, coming and just seeing us and knowing there is no judgment at all. It is truly, I a lot of times will equate addiction, if you think of when you tried to give something up for Lent, which we're in right now, or for a New Year's resolution, how difficult that was. Multiply substance abuse times 1,000, and that's what these individuals are struggling with. And so we have no judgment for where you're at in the process, and we just want to help you get to a place where you will have a healthy pregnancy, you will have a healthy baby, and ultimately you'll be able to take that baby home with you into a safe environment.
Now, I'm hearing before, during. Now, is it also still after? Because my fear is, what if, like you said, the stresses of the newborn stage is fun, sleepless, but it's rewarding, but you have to be mentally prepared for it. So do you abandon me after my baby's born? We
do not. We definitely don't. So the expectation is that you stay with us throughout that postpartum time period, and really until you're ready. We've had patients stay with us as long as almost 6 months after delivery, and we will walk that part with you as well, because it's so important to recovery to be in a space that you feel comfortable with the people there, and that we can, work with you to continue staying in recovery.
So you're working with me, we mentioned something, housing. Are there any other benefits for folks who maybe just aren't quite ready, like, you're just gonna come and try and take my baby? And I know that's not the goal.
It's definitely not the goal. And by being in this program, you're able to really build a kind of a resume for yourself of all the things that you have done to show Child Protective Services what you're doing to get ready for baby. And we help you get set up for WIC, make sure that you have a safe sleep environment, make sure housing, once again, is so important, and also prove that you have maintained your sobriety by checking in with us throughout that time period.
What if I'm just scared? Because as anyone who's given birth knows, it can be pretty scary.
Yes.
And then what if I relapse, or there's so much just fear and judgment and like unawareness. Now I know you said it's safe, but again, I can't always feel comfortable. That's probably why I'm taking what I'm taking.
Yep. Yeah. And I really encourage you to give us a try. If someone is out there, and I completely validate all of those feelings, and it is so scary to take that first step, but I can't really take much of the credit. I am the doctor you will see, but our social workers truly are like the heart of our program, and there is no judgment. We are here to just work with you to get you to a safe environment, and we all have that same goal. We do not want you to have your baby taken away if we can prevent it, and if it can be a safe environment. So I just really encourage anyone to just try it, see what happens. Come and give us a try. And like I said, there's no judgment. So if you try once and you say, that's it, I'm out, we understand that. But at least make that first step.
If I do want to, I'm listening. How do I reach out? What do I do? Who do I call?
So our information is on the screen, so call us anytime. Also, if you are in crisis, you can show up to St. Vincent's Medical Center anytime, and we can start the process of getting you connected to our clinic and can take care of you and get you into that New Beginnings program.
And just quickly before we take off, is there anything that the community, let's say I'm not affected, but I want to help. Can I do anything?
Just really, I think, providing support and encouragement to those around you and checking on your people, because a lot of people are struggling silently. And if you know someone that is struggling, we've had mothers bring their daughters to us. Friends come with another friend, especially to those first couple of appointments, because it's scary, like you said. And so if there's any way you can be that support for someone, I really encourage you to do that.
Doctor, thank you so much for taking the time. Definitely take that information, and we will be right back.